Great. That was that. Hopefully this is all recording now. Once again, welcome to Medical Society. If students keep joining now onwards, we just keep including them into the seminar. Um, from now until the end of the seminar, feel free to text me questions. So on the chat function, you can send it to my name. You can also send it to the main chat. We won't break flow to take questions in the middle, but at the end, I'll be able to pitch them to Dr. Dinesh. So feel free to send questions anytime. That's your operative permission here. Okay, so just to introduce our speaker really quickly, we were Dr. Dinesh today, who's a consultant in sports, exercise, and musculoskeletal medicine. He studied at Barts, which a few of you I know are aiming for, so might be worth asking about his experience there. And he's worked with elite teams in football, rugby, and athletics, which is across the English FA, the Singapore rugby teams, as well as Diamond League events. He's also served as a doctor at the London 2012 Olympics and Paralympics. There's a wealth of knowledge in the room with us today. And I'm just going to invite Dr. Dinesh to take it from there.
Thank you very much for the introduction, and thank you for all of you joining on a Sunday afternoon. I'm sure you've got many other things that would be of interest, and so thank you for coming to listen. Maybe I'll just share a few slides with you, and that'll just kind of get the ball rolling. So, okay. Maybe you could just give us thumbs up or something if you can see the slides. Is there a thumbs up option?
All good? Yes.
All good? All right,
Yes.
great. So I'll just carry on talking, and you'll know by the end of it that it's something that I enjoy doing. But if there are any questions, feel free to kind of post them along the way. So today we're going to talk a little bit about careers in sports medicine, and I've been in this field for the past sort of 10 to 15 years. And I thought as we're going along, maybe we can cover a few things. So first and foremost, what is sports medicine? Let's deal with the elephant in the room a little bit. Is it actually a medical specialty? And is it? How do we get there and everything? And who are sports medicine consultants? What is the typical training pathway that you might take to become a sports medicine consultant? What are the common sort of injuries that we may see in sports medicine? If you have an interest in it, how do you get started? Maybe talk about some of the challenges that we encounter as in this field as a career, and then a quick maybe quiz just to end it all off. And nothing high pressure, don't worry. It's really just to kind of summarize everything. So first and foremost, what is sports medicine?
I would guess it's something to do with medicine catered towards athletes, or
Mm-hmm.
what Sophie says is one of the healthcare area focusing on prevention or treatment of injuries related to physical activity or exercise.
Okay, that's pretty good. Area of medicine.
Sanvi has another option here. Area of medicine focused on dealing with injury prevention and treatment of athletes.
Okay, cool. So that's pretty good. Let's move on then. So, sports medicine is a specialty. Yes, you're right. Looking at the prevention, at the diagnosis and treatment and rehabilitation of injuries and medical conditions. So it's not just musculoskeletal issues, although that does form a large portion of what we do. It's also about medical problems. So looking at why somebody may not be performing well, why somebody's perhaps breathless, or do they have chest pains or something when they're exercising, and it's related to physical activity as well as sport. And now there's a difference between physical activity and sport. Physical activity is any kind of body movement. So if you're walking, if you're climbing stairs, that's considered physical activity. Whereas sport is a very defined form of physical activity where you're doing a specific role or your specific type of exercise.